In the last 2 years, Hywel Dda University Health Board has developed a comprehensive medical leadership programme. This has been designed to empower our staff and improve our leadership skills with the aim of improving patient outcomes. What we thought we'd do today is 4 senior leaders will meet and we will discuss through the medical leadership programme to give you the opportunity to understand what we put in place and how if you join this organisation you could significantly benefit from it. So I've been really impressed with the approach the Health Board has taken to medical leadership, we've now produced a really structured programme for the development of medical leaders. I've been very lucky to go on a system level leadership improvement programme which taught me a huge amount about leadership, and I'm convinced that has had a really positive impact in what I've been able to achieve in the last few years. What about you, Sean?
Yeah, similarly, in general practice, I think the opportunity's been there for GPs to be developed as leaders, and I think it's a real opportunity for general practice to have a voice within this health board and to be leading the organisation from a clinical perspective, really.
It's been very interesting to watch changes in people actually throughout. You say how much you've developed, and I've seen it. It's been very visible and palpable in the room. And what's been lovely about it is we have brought together primary and secondary care to show that they've got a voice as well.
So any leadership program, it should be a part and parcel of a growing organisation, and it's not just to inspire us, but to motivate us to actually inspire others. Personally, in me, it has given birth to a new kind of thinking. So initially, it was always what we do, how we do it. But programs like this will give you an idea as to why we do it. Because if we can figure out why we do something, then it's very easy to inspire others. Don't you agree?
And I think the Hywel Dda's commitment to giving us protected time, that's hugely important. All of us are in busy jobs, and especially operationally and clinically, we know that the winter that never ends. There's never any time to pull your head up and start thinking differently, but you're able to do it in a safe place and start thinking differently, because you've got, in all these groups, we've got real diversity.
And clearly we're focusing at the beginning of people's careers as well with the new consultant programme, and introducing peer support and peer mentoring as well early on in people's careers.
And there's career progression, there are opportunities to be GP lead, lead localities, so there's at every level within the organisation there's opportunity to lead, really.
And I think then that all links then into quality improvement, doesn't it? And then we have the EQUIP programme, which I think are involved in mine here, aren't you?
But it's lovely again, you've got people from nursing background, healthcare support, radiology, all different parts of the system coming together, and it's stopping that silo working. It's bringing us to and connecting us all together, really. But it's lovely to see the energy in the room with it. You build relationships, don't you, that you'll keep and progress, and then that will then filter out across the whole of the organisation. Absolutely.
We won an award at Improvement Cymru. Brilliant.
All this empowers people, doesn't it? And gives them the confidence and abilities and skills to then go out there and see the benefits. And I think we are definitely reaping the benefit of that in simply in the quality of care that we're delivering to patients.